Myself, Soumyaranjan Biswal, Assistant Professor, School of Pharmacy, Rai University. Today we are going to discuss about the topic urinary tract infection. So before going to discuss about the topic, first we have to know that what is infectious disease. Okay. So infectious disease are the disease which is mainly caused by the variety of pathogenic microorganisms, just like virus, bacteria, protozoa, fungi, and different other parasites also. And this infectious disease which is transmitted by the animals, a human, insect, and other organism. To our topic, urinary tract infection. So this is the infection that affect in any parts of urinary tract, just like kidney, ureter, bladder, and urethra. Okay, and the urinary tract infection which is mainly occurs in female as compared to male, because the urethra is very short in female. Okay, so female are mostly high risks to develop the urinary tract infection because of their short urethra. Okay, so next, classification of urinary tract infection. It is mainly classified into two types: upper urinary tract infection and lower urinary tract infection. So upper urinary tract infection, when the infection occurs in kidney and ureter. Okay, but lower urinary tract infection, the infection mainly occurs in bladder and urethra. Next, different causes of urinary tract infection. As you know, the infection which is mainly occurs by the bacterial infection. Okay, when the bacteria entering into the urinary tract and multiplying in the body. Okay, next, mainly the common bacteria is the Escherichia coli, that is E. coli, but other types of bacteria and fungi may also cause the urinary tract infections. So there are different causes of urinary tract infection, different causes and different factor for the urinary tract infection. First one is sexual activity. So especially in the women can introduce the bacteria into the urethra and leads to infection during their sex. Okay. Next is anatomy. When the women are the more prone to urinary tract infection due to their short urethra. Okay. In case of male, the urethra is longer, but in case of female, the urethra is very short. Okay. Next one is obstruction. Any type of obstruction or blockage may cause the urinary tract infection. Okay. Next, use of catheter. If you use the catheter for prolonged time, that may cause the infection. Okay, and develop the urinary tract infection. This is use of spermicides. Mainly, the spermicides can introduce the urinary tract infection, and that may cause the irritation in some women. Okay. Next, different other factors are there which may cause the urinary tract infection, just like urination in unhygiene condition, then use of contaminated clothes and napkins, then weak host defense mechanism also cause the urinary tract infection. Clinical manifestation or sign and symptoms. If the infection occurs in lower urinary tract, okay, so there are some symptoms are seen during the infection, just like pain or burning sensation during the urination. Okay. Next one is increase the frequency of urination also. Next, the sudden and strong desire to urinate. Okay. Next, hematuria, that is the blood in urine. Okay. Next one is the discomfort and pressure in the lower abdomen. Urinary tract infections. So all the symptoms of the lower urinary tract infection are seen. Okay, but another symptoms are flat pain, that is pain in backside. Okay. Next one is the fever and chills. Next one is nausea and vomiting. So these are the most common symptoms which mainly occurs or seen during the urinary tract infection. Son of infection. Mainly the urinary tract infection which is prevented by some simple step, like drinking lots of water, at least 6 to 8 glasses of water daily. Okay. Next, drinking water after having sex also. Next, cleaning the vaginal and rectal area daily. Okay. Next, urinate as soon as feel the needs rather than the holding on. Try to wear the curtain underwear and loose fitting clothes so that it can keep the area dry. Okay. Next one is take the vitamin C and cranberry juice, which is mainly act as a antiseptic. Okay, urinary antiseptic. So these are the most preventive step for the urinary tract infection. Treatment or drugs. Mainly the antibiotic which are used for the treatment of urinary tract infections, and when in the simple infection there are some medicines or drugs which are used, just like sulfamethoxazoles, trimethoprim, Next one is amoxicillin. This is also antibiotic. Then nitrofurantoin, then ampicillin, ciprofloxacin, and levofloxacin. These are the antibiotic which are mainly used in the simple infections or the urinary tract infection. Okay. Next, urinary tract infections may need to treatment with the intravenous antibiotic. Okay. When usually the symptoms clear within a few days of the treatment, but man needs to continue the antibiotic for a week or more. Okay. So this is all about the urinary tract infections. I hope you like this video. Thank you.